We're maniacally obsessed with health care, and we're not nearly focused enough on health in this country.
Healthcare is a human right.
The conversations we're having around the costs of healthcare and access are really important, but I think they miss the overall question of whether or not we have a healthy population. We spent more than $3.5 trillion in our national health expenditures. A third of it went to hospitals. 25% went to doctors and other kinds of providers. Pharmaceuticals account for a little bit less than 10%. Only about 2.5% are devoted to prevention, to really getting at the behaviors and the lifestyle changes that actually improve health outcomes. The Episcopal Health Foundation is a $1.2 billion fund. We work on behalf of the 11 million people who live in the Episcopal Diocese of Texas, and our emphasis is on low-income and vulnerable populations. What we're doing to change the conversation is working with health care providers to improve the health of their patients, not just delivering more medical services. We have clinics that see kids who have asthma attacks over and over again, and they have lots of medicines and they have inhalers, and so they're medically as well controlled as they can be, but they're still having asthma attacks. And so we work with a clinic that makes home visits and helps clean up the home or the apartment that the child is living in so that the asthma triggers aren't there, and that's delivering health. Hope Clinic is one of our very favorite grantees. They are innovative. They are on the ground with their community.
We saw a number of patients coming to the clinic complaining of neck pain, rashes in their hands, coughing, and we realized that a lot of these patients were actually nail salon workers. So we went to the community and helped people really understand how to address preventively those ailments.
I know you work at the nail salon. We wanted you to be careful with the chemicals that you're exposed to.
It doesn't cost much more for us to provide preventive care services. As a matter of fact, it's a saving cost strategy.
This program can absolutely be scaled on a national level. As a foundation, what we're best at doing is innovating, paying startup costs, demonstrating the value. But in the long run, the $3.5 trillion that our country spends on health every year needs to be redeployed so that it actually produces health and not just more health care.